The name of the condition is a mouthful, temporomandibular joint dysfunction, or TMJ, but the symptoms can go beyond the mouth. Dr. Ramsey Haddad of Skyview Cosmetic Enhancement Center is with us today to talk about the condition and its treatment. You're watching Daily Web TV. TMJ, sometimes referred to as lockjaw, is the topic of conversation today with Dr. Haddad. Dr. Haddad, first, what is exactly TMJ? What does that stand for? And what is it as a medical condition?
It's actually, the word TMJ means temporomandibular joint, which is really the joint between the mandible, which is the lower jaw, and the temple region, which is part of the skull. It's more known as TMD now, which is temporomandibular joint dysfunction. That's where it's a medical condition. So TMJ is just the anatomy of it. But TMD means anything wrong with the joint itself, because it could be either the cartilage that's between the joint, or it could be the muscles in the face. It's mostly the muscles in the face that go into cramp and spasm, and that causes a lot of pain.
And pain really is the key point here, isn't it? People really suffer a lot of discomfort with it.
The pain is probably the one that drives people to have treatment, because TMD can actually present itself in different ways: lockjaw, clicking, ringing in the ear, but it's the pain that actually drives people to seek medical help.
So you're saying, really, if you have any of those other symptoms, should you be seeking medical help before there's any pain there?
I think it's very well worth mentioning it to your doctor or to your dentist, because there's lots of things that can be done before we get into the big treatment for TMD.
Now, you're saying treatment. There is a treatment for this?
The treatment actually depends on the symptom itself, and the treatment has a very wide spectrum. It could be from something very simple as just watching what you eat, having good posture and eating soft food, to even up to surgery. But most of the treatment is all about getting the bite right, getting the teeth to bite in the right position where the muscles are very relaxed.
Okay, so you're saying that you as a dentist actually treat TMJ or TMD?
Some dentists treat temporomandibular joint dysfunction. I'm one of the people who do treat it, and there are different ways to treat it. I follow the neuromuscular concept, the neuromuscular treatment concept, which actually focuses on getting the muscles all relaxed and capturing that bite where when the teeth meet, the muscles are comfortable. And we try and emulate that position by making you a plate to wear to keep that jaw in that position.
Really?
Yeah.
That's fascinating. Is there anything you can do to prevent getting TMJ?
To prevent it is very difficult, because we use the jaw for eating and chewing and talking, and so it's very difficult to actually prevent it. But as long as we are aware of the symptoms that can actually arise from it, it's something that we can do very early on to try and stop the progress of it.
Progress, exactly. Yeah. Well, this is fascinating, and if someone would like to find out more about the treatment for TMJ, how could they get in touch with you?
They can go on our website, which is skyviewdental.ca, or they can phone us on 905-713-2222.
Thanks so much, Dr. Haddad.
Thank you. Thank you.
Don't suffer with any of the discomfort of TMJ. Make sure you get those early symptoms checked out. Keeping you informed, I'm Sheila Clark, and you've been watching Daily Web TV.